Warm welcome to today's talk, Friday, the 4th of February. Now, we want to look at quite a bit of data today. This channel's come in for some critique lately, so I want to make it clear that as far as we possibly can, we are going off primary source data, and where that's not available, good quality secondary source data. Now, let's look at the first few data sets I want to show you about, and this is about infection rates. Well, not so much infection rates as cases. Now, of course, the total number of people in a population that get infected with COVID, that's the infection rate. And then we're able to detect a small subset of those, well, varying size of subset of those, and that's the cases. So the cases are really the infections that we managed to catch at it, as it were. And really, I think we need to probably stop quoting these now. But I don't feel I can stop quoting them yet because the rest of the world seems to be fairly obsessed with them, even though they're not a particularly good metric anymore. And I'm going to give you some reasons for that now. So here we have some data, for example, cases down, but not necessarily infections is what we're saying here. So this is new daily confirmed COVID-19 cases per million. And we see that basically everywhere is going down. Australia, Canada, the United Kingdom, Australia, cases are going down. But of course, remember, this is cases. This is cases and not necessarily infections, because we don't catch all of the infections with our case analysis. So let's carry on this line of argument. So there we see the cases going down. Now, this is a direct quote from Professor Tim Spector from the world's leading COVID symptom tracker, ZOE study, of course. Confirmed government case data is missing thousands of lateral flow results, leading to massive under-reporting. So what Tim Spector's clearly saying here is that this is not accurate. There's massive under-reporting in the UK. But this subtle but important change in behaviour highlights the importance of having multiple methods to track COVID-19 in the population. And I've been getting similar reports from people in Australia who say the testing's been difficult to access. I've been getting information from people in the States who've been saying they've had difficulty with testing. Haven't had much direct information from Canada, but Australia, certainly there's been major problems with testing. So really, now that Omicron is basically everywhere, now that I think it's endemic, although I think there's some debate about that with SAGE at the moment, or with independent SAGE about that at the moment, but we'll leave that as a separate topic. I think Omicron is becoming endemic as we speak. Given that that's the case, why would we worry about the few cases that we actually catch at it when these infections are everywhere? So it seems a bit of an old-fashioned parameter. It's been very useful in the past, massively useful in the past, perhaps less so now. Hospitalizations are more important. I've got some really good data on intensive care admissions just coming up as well. So just stick around for that if you've got time. So going back to this data here. Now this is the Tim Spector data. And we see an uptick there in symptomatic cases. And of course, Tim Spector and his team do correlate this with testing, which we're not really seeing on the government data yet, partly because the government is not accounting for the government figures don't have the flexibility to account for the change in testing methods. So we definitely see that uptick. And just to emphasise that there it is, nicely blown up for us. There's definitely an uptick in symptomatic cases over the past, I would say that's over about the past 7 days there. So no question, we saw a similar rebound, the second peak during the Delta wave as people relaxed and more children went back to school. Again, that's Tim Spector saying that this is not surprising. Basically, he's saying we would expect to see this. Number of COVID-19 patients in hospital per million. Now, these are much more genuine data sets. So the United States hospitalizations are going down, Canada, the United Kingdom, Australia, they are all going down. And this is genuine because we can collect the data directly from hospitals. Now, I want to look now at what we call ICNARC data. Now, when I was working on intensive care, we had to fill lots of forms and things like that for ICNARC data. Intensive Care National Audit and Research Centre. And it was one poor person's job to sit there putting all this data in, and it took quite a lot of time. We used to have a dedicated monitor for that. I won't name her, but but she knows who she is. Putting in the ICNARC data for our intensive care unit in Carlisle. Anyway, Intensive Care and National Audit and Research Centre, really superb data set. The data these guys collect and correlate and analyse is truly impressive. This is a definitive source of data. It really is. So here we have the first one we want to look at. Now, this one here. Now, this area here is Delta dominant area time. This is transition period, and this is Omicron time. And even though we can't see a lot of detail on that slide due to my technology limitations today, we do see a definite downward trend in the Delta time. So it's clear that intensive care unit admissions and the need for high level interventions and mechanical ventilation has plummeted as Omicron has replaced Delta. In this respect, this is a true blessing that this has happened. Just look at those intensive care admissions. It really is quite remarkably good news. Really, really going down. So these are where the dark blue there is where COVID-19 was the primary cause of admission. Here it was an associated cause of admission. But here we see this average going down really quite dramatically during the period of Omicron. And of course, the links there, you can peruse this graphic and quite a few others actually there. And again, here we see number and percentage of admissions to critical care with confirmed COVID-19, that COVID-19 reported as the primary diagnosis, In other words, the reason why they were in intensive care, not that they happened to be admitted to intensive care with it. And again, we just see that massive reduction during the Omicron period. So, I mean, basically, this is the Omicron period starting here about December, and straight after that, we start seeing this great reduction. Didn't go down that quickly straight away because of lots of Delta hangover cases, of course. And now this one is number of new patients admitted to critical care compared with hospital admissions. So what we do see is hospital admissions have gone up during Omicron, but intensive care admissions have gone right down. And I think I've got a blow up of that just to show you that. Yeah, we have. So what we have, hospital admissions have gone up. Yes, they've gone up. But intensive care admissions, I mean, wow, they've absolutely plummeted. So we see that there is way fewer patients being admitted to intensive care in the time of Omicron. And in the early time of Omicron, we still had this Delta hangover period, this transition period. So this is definitive data. So even my most vocal critics, I don't think, can argue with that too much because it's straight from ICNARC. There we go. There it is. That is the ICNARC data. So pretty convincing to me, and I'm sure to you, just from the shape of that downward orange line. And just to remind ourselves, that is number of new patients admitted to critical care compared with hospital admissions. So hospital admissions up, intensive care admissions down. Good. Now this graphic here, again, this is ICNARC, percentage of admissions to critical care with confirmed COVID-19 by vaccination status. So what they've got here is, this is the vaccination status of the general population. And this is the vaccination status of people that are admitted. So we do see here, some people that have had 3 doses of vaccine are being admitted to intensive care. Some people with 2 doses of vaccine are being admitted to intensive care. So that is still a problem. It's not absolute. The vaccines are giving large levels of protection. So we see that the unvaccinated are disproportionately represented in intensive care admissions, significantly disproportionately represented, showing the high level of protection against intensive care that vaccination gives, at least in the current population at the moment. And then comparing that to the States, 3 doses protection against Omicron, CDC data, ED and urgent care encounters, as they describe it, down 82%. 82% compared to the unvaccinated, 82% protection, in other words, from 3 doses of vaccine. and COVID-associated hospital admission, 90% protection. So we're clearly seeing in the UK data that vaccination is giving good levels of protection, not absolute, good levels of protection against critical care admission. And we're also seeing that in the United States. So consistency between the two countries, which is always nice, because we've got the ICNARC data set, which is one data set, and we've got the CDC data set, which is a completely different data set. And essentially, okay, the percentages are slightly different, but they're essentially in agreement, and multiple collaboration means that we are potentially on the way to truth. How do we know something is true? Because it's multiply collaborated is one way to consider it. Now, moving on to the excellent COVID symptom tracker data now. There we go. So this is from Tim Spector. Now, the first graph here, we show the first graphic from Tim Spector's team is the number of ZOA study UK incidence figures, a total number of daily new cases, and we definitely see it's going up. That really is unmistakable in terms of reported symptomatic cases. Moving on to the again, incident figures, results over time, total number of new cases in the new and fully vaccinated. So these are newly symptomatic cases. Now, this is in the vaccinated population. Now, this is the people that are fully vaccinated. So we're still counting that as 2 vaccines. Actually, the people in here will have had 2 or 3 vaccines. I don't think Tim's data is differentiating. I hope you'll correct me if I'm wrong, but I don't think it's differentiating between people who've had 2 doses and 3 doses of vaccine. But we see symptomatic infections definitely ticking up in those people. This is the total population that includes vaccinated and unvaccinated, which includes children as well, of course. And we do see that is higher, but we definitely see an uptick in cases, and we definitely notice that lots of people with 2 and 3 doses of vaccine are still getting symptomatic Omicron, because we are now 99% Omicron in the UK. Age group. So this is the 0 to 17 age group here, which has gone up after going to school. And of course, this affects the green group, which is the 35 to 54-year-old age group, which is their parents. Slightly concerning increases in the older age groups as well. That's the current ZOE data. This one here, a comparison of new common cold-like illnesses. So what we have here is which way around is this? We have the comparison. So the blue is COVID with respiratory symptoms. That's it. So this is people who've got respiratory common cold-type symptoms with COVID. And we saw that for a while that was more common. Now it's slightly less common. So if you've got a common cold in the UK, it's more likely to be non-COVID. So this orange line is all the other respiratory viruses that aren't COVID. So it's more likely to be non-COVID, but there's still a pretty good chance it is COVID. So remember, common cold features still very likely to represent a COVID infection. Now, this is really quite interesting, and it goes back to more our thinking about natural immunity, because I believe, that natural immunity is the only way to true endemicity, when it becomes endemic and basically getting all this COVID palaver out of our lives, which is what everyone wants. We cannot be vaccinating people, realistically. It's logistically impossible to be vaccinating the world's population every 6 months. Never mind the populations in advanced countries. Even then, it's pretty difficult. So we have to have natural immunity, as we have virtually every other respiratory virus. There's no reason why this one should be different. Now, I think there's a bit of debate to come on that, but that's kind of my starting position now. We need natural immunity in terms of longevity, because we can't keep vaccinating everyone. I just don't see that can work. So I don't see we have any alternative. Anyway, so here we have reinfections. Now, 7 to 8% of people who have reported symptomatic COVID during this Omicron period had been diagnosed, had Delta or Alpha, so a very small percentage. This indicates to me that infection with alpha or delta is largely protecting. I mean, this would indicate over 90% protection against symptomatic Omicron. Interesting. Now, of course, this doesn't take into account whether these people are vaccinated or not. A lot of them will have been vaccinated, so it doesn't differentiate. So what we can fairly say, because we want to be fair, is this represents population-based immunity from natural infection, also from vaccination. So we've got a bit of an overlap in the sets there. Now, this paper is from the States, American JAMA, Journal of the American Medical Association. Association between 3 doses of mRNA COVID-19 vaccine and symptomatic infection caused by SARS coronavirus to Omicron and Delta, but I'm only going to give you the Omicron data. Prior receipt of 3 mRNA vaccine doses reported for 18.6% of Omicron cases. So these are people, 18.6 with 3 doses of vaccine, still got symptomatic Omicron. Whereas for the people that had previous natural infection, it was only 7 to 8%. So interesting, again, indicating natural infection is giving good levels of immunity. And this is a direct quote from the paper here. This is a direct quote. Prior infection of prior receipt of 3 mRNA vaccine doses reported 18.6 of Omicron cases. So quite a bit higher than the natural immunity cohort from the UK. Now, this is back to Tim Spector's data here. Approaching 2,000 new cases a day, so it's definitely going up. As Omicron is less severe in a vaccine, hospitalizations, intensive care units and deaths are still going down, Tim Spector said, as Omicron is less severe in a vaccinated population. Now, of course, Professor Spector is being very correct. He's only taking the data from the population he's got, as a good scientist should do. And of course, the UK is a largely vaccinated population. So it's entirely right to say that this is data from a highly vaccinated population relative to Omicron. But of course, we did hear from the Ugandan doctors last week, who are also finding much milder illness in Omicron, the age of Omicron in Uganda, in a very poorly vaccinated population. So we can certainly, of course, the vaccines are providing protection against severe disease, as we've seen. But in poorer countries where they're not vaccinated, one of the doctors there said that Omicron is the vaccine we failed to make, was one of the views of one of those doctors from Uganda. And he's the man on the spot, so I'm not going to argue with that. Again, these are direct quotes here from Tim Spector. Hospitalizations down as Omicron less severe in a vaccinated population. Quite correct. He's quite correct. It seems many are again preempting the end of the COVID-19 pandemic. Now, he doesn't mention Denmark there, but I'm just wondering if Tim Spector had Denmark in mind. It's going to be so interesting to watch Denmark over the next couple of weeks. Of course, we really hope the people of Denmark the best possible outcome. But it's still going to be really interesting, as basically they declared the end of the pandemic. So it's going to be remarkably interesting to see what happens there. And of course, we'll be watching that very closely indeed. Very interesting. So anyway, I don't want to put words in Professor Spector's mouth. Maybe I wasn't thinking about Denmark at all. It seems many are again preempting the end of the COVID-19 pandemic. It's much too early for this, Tim Spector says. High rates of cases will be with us until late spring, before the warmer weather and summer holidays help to reduce infections again. And of course, this is inevitable. I agree 100% with him. We're going to still see high infection rates, partly reflected by cases. And it shows the power of citizen science that the log with Zoe every day. I agree completely. I forget. I'll probably forget about. I'll probably forget about one day a fortnight to fill it out if I'm distracted with something. But basically, I fill out my COVID symptom tracker app every day, and it's a great. You just feel even though you're feeling fine. All this data is important. This is all citizen science data, and it's great to know that we can contribute data to get this this most powerful current assessment tool of COVID in the world, and we can all contribute, and it doesn't cost us anything. It's just absolutely excellent. I really love the concept of citizen science. I think we should do much more of it. Everyone can be involved, and it gives people ownership as well. We need. It's what we saw about Denmark yesterday. Now, counter arguments been given, of course, as we might mention in a future video. There's always counter argument, which we're willing to accept. But basically, I think it's still fair to say that Denmark has gone ahead more cohesively than other countries that could be mentioned. So that is interesting. Now, patients. Here we are. Just a bit of current data from the UK. Patients admitted to hospital, it's going down. It's going down. As Omicron has replaced Delta, it's going down. So that's patients admitted to hospital. That's over the last, that's basically the January data, isn't it? 3rd of January up to about the 1st of February. So that's patients, that's hospital admissions. But are these patients hanging around in hospital for a long period of time? Well, patients actually in hospital, well, no, on the whole, they're not. So this is telling us that the average length of stay is not that long. The total number of patients in hospital is starting to go down. So it looks like it peaked there, round about the 9th, 10th, 11th, 12th, that kind of area there of January. Now, of course, things are still difficult in hospitals, but it's the trend is good. The trend is good. And as we've seen with the IGNITE data, just carrying on going down, the trend is going down. Had been going down the month before this as well. Probably late December it started going down a bit. Omicron is just dramatically. I think what we can say is there's a dramatic temporal correlation between the increasing prevalence of Omicron and the reduction of patients in intensive care. And I think there's good reason to believe that is a causal temporal correlation. It's my view that the large number of Omicron infections has resulted in a reduction in intensive care, not intrinsically, but because the large number of Omicron infections has displaced the infections with Delta. And it was the Delta that was associated with intensive care. In this sense, Omicron has rescued us out of the clutches of Delta. That's the way I read this, and I'm greatly encouraged. Now, just a couple of your comments, which we love to get, of course. Northern. I'm a retired registered nurse. Over the last several weeks, I have had many friends and family come down with COVID, including myself, and we hope you are feeling much better now, Northern. And we believe you are. We all weathered it fine, except for one 61-year-old female relative. She developed pneumonia, ended up in hospital for 3 days. Thankfully, she's now home with oxygen, PRN is nurse speak for when required. So delighted to see your relative is better, Northern. That is excellent news. But she's the only one who is morbidly obese, type 2 diabetic with poorly controlled blood sugar. To me, this says a lot about risk. And Pitchfork makes a really interesting observation about the states. And this has got implications way beyond Omicron. There's an epidemic of lifestyle factor related pathology all over the Western world, but the United States, it seems to be more pronounced. Let's just look at this reflection from Pitchfork, which I think sums it up really, really well. So thank you for this, Pitchfork. Let's just read what you've said. As a kid in grade school in Boston during the 1970s and 1980s, I remember that there were always 3 or 4 kids who had weight problems in my class. Okay, fair enough. When I was a substitute teacher from about 2000 to 2008, more than half of the students in any given class had weight problems. So dramatic increase in the time it's taken Pitchfork to go from being in school to being a teacher. This problem has been trending in the wrong direction for decades in the United States, exacerbated by cheap, unhealthy fast food and sedentary lifestyles. So maybe this is a kind of a wake-up call that's needed, as these are the people, of course, that are suffering from so many comorbidities. And why the intensive care rate, hospital admission rate, and indeed death rate in the States has been so appallingly high. Believe we're over the worst of it now, but of course the obesity hasn't gone away. It's just that the COVID has sort of highlighted the problem. I mean, we really need to start thinking about this quite seriously. Poor diet, poor lack of exercise, obesity, then obesity leads on to diabetes, hypertension, metabolic syndrome. And I know a lot of the food in the United States is suboptimal. Let's hope there's never any situations where food manufacturers and drinks manufacturers are prioritising their profits over people's health. Let's hope that's not happening. But I'll leave you to decide whether it is or not. Now, apologies. I did promise you this from Johns Hopkins, and I just didn't have enough time. But I am going to do it. The effects of lockdown from Johns Hopkins, which is really quite interesting and will give a lot of us significant pause for reflection, and hopefully those in government. Trouble is, those on government have probably moved on to well-paid consultancies and won't be there to carry the can if they've made mistakes. But there you go, that's just me being cynical. I'll shut up now. Thank you for watching.